Annually, there are more than 250,000 women who are diagnosed with breast cancer at age 40 or younger. Lurene Cachola has more on the impact of the disease.
A recently published study in the journal Cancer looked at breast cancer deaths and found what may be surprising news. 71% of those deaths occurred among mostly younger women who had not been screened for cancer. That, say researchers, supports calls for women to begin screening at the age of 40.
Women over their lifetime have about a 1 in 8 chance of developing breast cancer.
Dr. Lynn Gaden, radiologist at the Baptist Women's Health Center, says a number of factors are involved in determining when women should begin screening. Those factors include uncontrollable genetic factors and controllable lifestyle factors.
For women who really have no specific risk, we start at age 40. For women who have a family history, we look at the woman's family members and take the youngest family member who developed cancer, and we start about 10 years younger than that. So if your mom had breast cancer at 40, we would start doing mammograms at age 30.
And evidence of a specific genetic defect can also affect risk. The BRCA1 and BRCA2 genes offer protection from cancer. People inherit one copy of each gene from their mother and another from their father. As long as there are two working copies, there is protection from cancer.
It's when that second copy gets a mistake or a mutation in it that we lose that protection from cancer. So that doesn't mean you're going to wake up with cancer the next day. It means that now you don't have that protection, so processes that are going on are not being fixed or halted.
And because a genetic defect can greatly increase risk, people with genetic defects are encouraged to work with specially trained professionals to help them determine their overall risk of disease, along with potential responses, which can include increased screening or treatment.
Meeting with a genetic counselor who can help them sort all of that out, gather all the family history from both sides as far back as we can go, but certainly at least hopefully back to your grandparents and your aunts and uncles and cousins.
Two of the biggest risk factors remain sex and age. Being a woman and getting older both mean more risk of breast cancer. If those, along with other factors, push the lifetime risk of breast cancer into the 20 to 25% range, doctors will encourage self-exams, regular physician exams, and enhanced screenings.
Then we begin to look at mammograms once a year and alternating with MRIs, so that you have, generally the way in our center and most places do it, we have a mammogram, and then 6 months later you have an MRI, so that you're having one MRI a year and one mammogram a year, but they're staggered by 6 months.
Because for some women, the biggest risk can come from not being screened. For Smart Medicine, I'm Lurene Cachola.